enuanom ye kan say ya na ebia madwene na me kon mesre meka ebia ebe fa no trada sa na se yade se de enkrofo ka ana ye kan ne kasem se yade ya obi benya wone firi yare no ene ma eti sei no se utomu bia begidi se otia se ana se bi ba wa kwan mu se bi ntia ene nti minim yi se momma yemfa ye twrodua ne ye book na yenya so pa ntie fi se saa asem wi a ye betie se yeseke ye kofa ne baabi a ka enye mre eye mia me wo fase ana me ba nyame adom no ewo saa nimdie no mu na they are proud of him on so many things. Free seminini din komo se doctor me sro me pese me do ko agoprama eye kese no wose wow na me se wow nyame sa no ye ne nema kakra memo no aka no ho asem kakra but die minimo a metimi aka ne se we medical graduate a we doctor ni mua na ne ntetie no wonya efri Ghana ya yekrum nti ote ade na se ewo KNUST ena ne clinical training no ana bebia ode ne nsa ko hu yade ne se de yesane ye ho adwuma ene de wasua ka ho no oye no komfo anoche teaching hospital emprimpri ye nyame adom o Canada osua ade ewo ne healthcare journey focus se health system wa eye obetimi ya practice family medicine misasafo yehowa se saa ambition yi nyame ma ne mremu na wontimi moa yemu bebre titru bi na ode be man no akra metimi aka me proud say me ba Dr. Jones so ene na wofo ni nuanom ne adofo no bebre wo so a ye be support no yen se bre kra no KOFI doctor we de me musa ofi meka se Dr. AGYAPONG menkanza say ye kase Dr. KOFI AGYAPONG wa who is he on one we de me pese wa yi hu adi kire.
Okay. Hello and good evening. Thank you for this opportunity, by the way, Uncle. I think Sawaka DBI. So my name is KOFI AGYAPONG, and I graduated medical school in KNUST, which is Kwame Nkrumah University of Science and Technology in Kumasi. And I'm now currently in Canada, pursuing my medical license here, hopefully to start my residency in family medicine. And due to some experiences I had in Ghana, I have a particular interest in maternal and community health. So I hope to be able to further those interests here in Canada. So I think that's a brief general background about me.
Thank you so much, KOFI. Now one can parents cry. Said ye be home na be cry near no muna and tears all can.
Yeah, true. So yeah, I guess we're all family here. So I see my mother is on here, Josephine AGYAPONG, and my dad is Kwame AGYAPONG, both from Prince of Peace in Columbus, Ohio. So those are my parents, in case you do know them. Yeah.
KOFI yadawase. Adofonom the person meka ayi kakra bi a yebepon a meka ho asem kakra. Nyame ye nyankopon oboye no. Se yare ne nka na debo ho. Bone ne kofa bae. Na free na ekuri yi ye befa kwan a ye duane best ye edru obi kan sa let your food be your medicine ene ahwe yi a esese ye woni emabi hu nti KOFI without wasting time no obeka brofo odi twi nso befam woti twi pa nti misrese yedru ho se opeso oka na moye na dum ansa na KOFI ubekasa no mesre mini aba Josephine mpacho mute self nafa ye ba KOFI share the instagram ko emai why Mami Jo
pamucho mo mi amompaye Ɔsorosoro he yɛda wase adom ne ahomɔborɔ deɛ ɔde abɛduru ayɛyie nka wo din. Saa bere yi yɛde Kofi hyɛ wo nsa o. Wadaro ma baabi a ade na abɛduru. Yɛsrɛ wo ankasa nimdeɛ a wonam ne so de ma yɛn. Yɛsrɛ wo ka ne ho. Yi ahopopo biara firi ne mu. Na deɛ wɔde adom no no ma ɔnkae na ɔno nso fa ma yɛn. Yɛso yɛntie ne yɛntimi mfa mmɔbra. Yɛda wase wadom ti. Amen.
Amen.
Okay, I'll share my screen.
All right, Kofi, yetio.
Okay.
Why?
Okay.
Auntie Joe, yada wasi bre.
Okay. Is my screen visible?
Yes, we can see.
Okay. Okay. Okay, so today's presentation will be on diabetes mellitus. So the goal of today's talk is basically to simplify diabetes for those who may have it, those who may be at risk for it, and provide certain strategies to help prevent and some ways to manage or control diabetes. And as I mentioned before, my name is Kofi AGYAPONG, and I'm a medical graduate from Kane UST, Kwame Nkrumah University of Science and Technology. So I guess before we really dive into the topic, I'll just briefly explain what the word diabetes mellitus actually means and the background of it. So the word diabetes is actually taken from a Greek word called diabene. So it means to pass through. So that basically refers to one of the major symptoms of diabetes, which is frequent and excessive urination. And then the second part, mellitus, is a Latin word meaning honeyed or sweet. So that refers to the high concentration of sugar or glucose that are found in individuals with diabetes mellitus. So the term diabetes mellitus itself just basically means the high concentrations of glucose or sugar that are found in the urine of patients or diabetic patients. So in order to understand diabetes, I have to explain the hormone insulin. So insulin is a hormone that the pancreas, which is an organ in the body, produces. And what leads the body to produce insulin is when you take in any type of food that is rich in glucose. It stimulates the pancreas to release the hormone insulin. So basically, insulin's role, or one of the roles in the body of insulin, is to bring in the glucose from the bloodstream for the cells to be able to use. So if you have any problem with insulin, where insulin is defective or insulin is insufficient, that means that your body will not be able to properly utilize the glucose in the bloodstream. So it builds up in the bloodstream, which is what we call hyperglycemia. And this is what leads to the symptoms of diabetes, which we'll discuss later on. So as you can see here, number one, this is a diagram showing like glucose coming into the blood vessels. And then two, that leads to the pancreas releasing insulin. And then insulin works on the body's target cells. And what the cells will then do because of insulin will to be able to bring in the glucose and utilize it for energy. So how insulin works. So you can basically think of insulin as a key, right? So insulin is basically the key that the cells use to unlock the blood, right? For the glucose to be able to come into the cells. So you see here we have insulin, right? And this is the insulin receptor. So you think of insulin as a key, and you can think of the receptor as, let's say, the keyhole, like putting your key into a door handle. So basically, once insulin binds to this receptor, it opens up the glucose channel in the cells so that glucose can leave the bloodstream and enter the cells. So over here, we see insulin binding to the receptor, the glucose channel opens, and then glucose enters the bloodstream. The cells, sorry. So this is when insulin functions normally. So when there's a problem with insulin, that's when the glucose isn't able to enter the body's blood cells, and then it increases in the bloodstream. So here we define diabetes mellitus itself. So when we say diabetes mellitus, so diabetes mellitus is a chronic condition, meaning it's something that occurs over time. You don't just wake up one day and have diabetes. Although some people are asymptomatic, which means they show no signs or symptoms. So you may go to the doctor one day and may randomly check your blood glucose and say that you have diabetes mellitus, but it's not something that occurs at one day. It means that it's been developing over time. So diabetes mellitus is characterized by high levels of sugar or glucose in the blood. So it occurs when the body is either unable to produce enough insulin or it is unable to effectively utilize the insulin that it produces. And as I mentioned before, insulin is the hormone that regulates the blood sugar levels. So a good phrase or a popular phrase to describe diabetes mellitus is starvation in the midst of plenty. So you can also think of this as, so basically if the body cells could speak, it would say, I know our former president, Akufo-Addo, once had, before he became president, he had a speech where he said, "Yetisikaso badekomdeye." So that's pretty much what's going on with diabetes. So the sika would be the glucose, right? There's excessive amounts of glucose in the blood, but still the body is starving. Why? That's because the insulin is either insufficient or is defective. So what happens with diabetes mellitus is that the body's main source of fuel, which is glucose, is abundant in the bloodstream, yet unavailable to the cells of the body. So despite the abundance of glucose in the body's tissues are starved for energy because insulin is either deficient or resistant, which leads to the symptoms of diabetes. So here, these are the three main types of diabetes mellitus. We have type 1, type 2, and gestational diabetes. So for most of this particular talk, we'll be focusing on type 2 diabetes because that is the most common type of diabetes. Gestational diabetes is specific to pregnant women, so that can be for a separate topic. But if you are a woman who's been pregnant before and you have a history of diabetes mellitus, gestational diabetes that is, it is important to know that both you and your child are at increased risk for type 2 diabetes. So it's advisable that you speak to your doctor about when you yourself as the mother should be screened for diabetes and when it would be best for your child to also be screened by diabetes. So with type 1 diabetes, what's going on is that the insulin is either deficient or the body is not producing insulin at all. So with type 1 diabetes is an autoimmune condition, meaning that your body is mistakenly attacking its own cells. So the cells of the pancreas that produce insulin are being attacked because the body is somehow recognizing it as foreign. So because of that, the pancreas cannot produce enough amounts of insulin, or it does not produce insulin at all. So you have glucose in your bloodstream, but the body cells aren't able to utilize it, leading to increased amounts of glucose in the bloodstream. And when we come to type 2 diabetes, with type 2 diabetes, your body does produce insulin, but the problem is because of one or two things, the body is resistant to the effects of insulin. So I'll go over the risk factors for that in a different slide. So because your body is resistant to insulin, it means that the cells aren't able to work properly. They can't bring in glucose because insulin is there, but insulin isn't working properly. And for gestational diabetes, I'll just briefly explain what's going on. With gestational diabetes, it's actually a normal mechanism that causes increased amounts of blood. So in pregnancy, there's a particular hormone that the body produces. It comes from the placenta. And the purpose of this hormone is to make insulin a bit resistant so that the glucose in your body will increase. And it does this because of the fetus. So when you're pregnant, we always say that when you're pregnant, you're eating for two, which is literally the truth. So what the body does is it wants insulin to be a bit resistant so that there's enough glucose for the mother and also enough glucose for the infant. the baby. So the problem comes when the body isn't able to produce enough insulin to counter that resistance. So just some quick facts on diabetes mellitus. Sorry, it may be a bit blurry, but I'll read out all the statistics here. So generally, according to the World Health Organization, there are actually over 800 million people in the world right now that live with diabetes. And about almost 50% of these people don't even know that they have diabetes. So diabetes mellitus is a very, very, very prevalent condition in the world today. So these are basically some statistics about diabetes in Canada, this one, and then these are the statistics of diabetes in the United States. So we have here, it says 1 in 3 Canadians, which is 11 million Canadians, have diabetes or prediabetes. So I'll define prediabetes in a later slide. And it says another Canadian is diagnosed every 3 minutes. There's somebody diagnosed with diabetes. And there are 1.5 million Canadians who have type 2 diabetes and don't know it. So there's 6 million Canadians who live with prediabetes, and half of these 6 million would develop type 2 diabetes if nothing is done. So with diabetes is a very manageable condition, but if left to develop without proper management, the complications are severe. So as we have here in Canada, 30% of all strokes are caused from complications of diabetes. 40% of all heart attacks are because of diabetic complications. And 50% of kidney failure requiring dialysis is due to diabetes. Then we have here 70% of all non-traumatic leg and foot amputations are due to diabetes as well. So here we'll discuss in the United States. So in the United States, 37 million people have diabetes. So that's about 1 in every 10 people have diabetes mellitus in the United States. And 1 in 5 people don't know that they have it. So this just goes to let you know that although there are signs and symptoms of diabetes mellitus, a lot of people may be asymptomatic. So you might not know that you have diabetes at all, which is why it is important to speak to your family physician or whoever your family doctor is about screening guidelines and when it is necessary for you, the individual, to be screened for diabetes mellitus, especially if you have any close family members who have had diabetes mellitus before. So if you're somebody, let's say your mother, your father, your sister, your brother, or something has had diabetes before, that alone puts you at risk for diabetes mellitus. So with prediabetes, which we'll explain later on, there's 96 million American adults, which is more than 1 in 3 adults have prediabetes. And 8 in 10 of these adults don't know that they have diabetes. So the risk factors. So with risk factors is basically anything that increases your chances of developing a particular health condition, right? And with all or almost all health conditions, we have modifiable risk factors and non-modifiable risk factors. So modifiable risk factors are the risk factors that you can control, right? And then non-modifiable risk factors, you can't do anything about it. So starting with the modifiable risk factors, physical inactivity, high body fat or body weight, high blood pressure, and high cholesterol are all risk factors that increases your chances of developing type 2 diabetes specifically. So with type 1 diabetes, the risk factors are just mainly age. Age over 45 years is for type 2 diabetes. For type 1 diabetes, is more common in adolescents. So there's 2 particular age groups that face type 1 diabetes diagnosis. That would be those from the ages of 4 to 7 and 10 to 14, with 10 to 14 being the most common. And with type 2 diabetes, age over 45 years, history of gestational diabetes, Race and ethnicity is both a risk factor for type 1 and type 2. Family history is also a risk factor for both type 1 and type 2 diabetes mellitus. So here are some signs and symptoms of type 1 and type 2 diabetes mellitus. So just because of time, I'll explain 3. So the 3 most common or the 3 most popular signs and symptoms of diabetes mellitus will be frequent urination, the feeling of excessive hunger, and constant thirst. So all of this is due to the excessive levels of glucose in the bloodstream. So glucose, normally a majority of the glucose that you intake into the body is reabsorbed by the kidneys. So what happens when you have too much glucose in the bloodstream is that the kidneys reaches its capacity. So the excess amount of glucose is excreted in urine. So what happens with glucose is that glucose is a kind of substance that where it goes, it pulls water. So because there will be a lot of glucose in the urine, it'll pull water with it. So that's what causes the frequent urination. And as you're urinating frequently and excessively, your body is losing fluid. So your body's thirst mechanism signals your body that it's thirsty. So that's what will cause people with diabetes to have a constant feeling of thirst. And then the third one, which is the feeling hungry, is because, so what insulin is normally is an anabolic hormone, meaning that it builds up. So when insulin isn't working properly, your body has to find other ways to create fuel, other sources of fuel. So it breaks down different molecules in the body to use that as the fuel. So because your body's breaking down these molecules, it gives that feeling of hunger. And then the other symptoms that we have here, blurry vision, numbness in the hands and feet, feeling tired, unplanned weight loss, irritation, and mood changes. These are all due to the excessive amounts of glucose in the blood. So symptoms of hypoglycemia. So I know for the majority of this talk, we've been talking about hyperglycemia, but recognizing the symptoms of hypoglycemia is also important, especially for type 1 diabetics. So for type 1 diabetics, you're going to be on a daily administration of insulin, right? And insulin's job is to bring the glucose into the cells. So if you're not careful, maybe you take too much insulin, or maybe you feel like because you're on insulin, you feel like your blood glucose is normal, so you might not take the insulin. So what happens then is that if you take too much insulin and your body brings in too much glucose, and now you have now there's not enough glucose in the body, there's certain symptoms that occur. So when that happens, basically your body goes into a fight mode, which means that your sympathetic nervous system is activated. So it's kind of the same mode where you may go in when something frightens you or something angers you or you're annoyed and you're pissed off. So you feel your body starts to shake or tremble, your heartbeat increases, you feel an extreme sense of hunger. There might be sweating, you can't think straight, there's confusion, difficulty concentrating, and dizziness. So a lot of times there may be, I don't know if you guys have ever come across the news of type 1 diabetics maybe getting into car accidents and whatnot. It's because that they allowed, for whatever reason, their blood glucose sugars drop below threshold. So for type 1 diabetics and for some patients who are type 2 diabetics, there's certain medications that you may be on that may increase your chances of having hypoglycemia. So screening, so investigations that is used to diagnose diabetes. So first in adults, and these recommendations are from the American Diabetes Association. So the American Diabetes Association pretty much recommends that all adults at the age of 35, this is regardless of whether or not you have any risk factors or whether or not you're experiencing any symptoms or not. So saying all adults at the age 35 and above should be screened for diabetes, type 1, type 2. They should be screened for diabetes. And also for overweight or obese adults of any age with at least one additional risk factor. So even if you're not 30, let's say you're 25 years old, but you're obese, so you're overweight, you have close family members who've had diabetes before, you shouldn't wait till the age of 35 before going to your doctor to discuss screening for diabetes. So basically, those at the age of 35, if you're screened for diabetes and your test results are normal, screening should be repeated every 3 years. But individuals with pre-diabetes should be retested every year. So as I mentioned before, some of these risk factors that I mentioned include family history, being of a high risk race or ethnicity, which includes us Africans and African Americans, high blood pressure, high cholesterol, history of diabetes, and physical inactivity. So for children and adolescents, starting at the age of 10, we screen all overweight and obese children starting at the age of 10 or after puberty if they have at least one additional risk factor. So as mentioned, the risk factors that we're speaking of here include the family history of type 2 diabetes or being born to a mother with gestational diabetes. So also another group of individuals that require screening are the patients on certain medications. Now, normally, if you're on a certain medication that might lead to diabetes, your doctor should let you know of this. Or if you're on some medications and you're not sure, you could contact your doctor and ask about this. So some of these medications include glucocorticoids, which are steroids, statins. Statins are used for those with high cholesterol. Thiazides is a type of diuretic mainly used as an antihypertensive, so for those who have high blood pressure. And second generation antipsychotics are used to treat different types of mental conditions. So some of the specific investigations that are used, or some of the most common ones, are hemoglobin A1C. So what this test does, it basically tests your glucose concentrations over a period of 2 to 3 months. Normally this is done in the hospital, but you can order a home test kit and check this yourself. So a normal healthy individual has an A1C level below 5.7%. Pre-diabetes will be between the range of 5.7 and 6.4%. And those above 6.5% are considered to be diabetics. So I think this is probably the more common one that we know about, the fasting plasma glucose. So basically the fasting plasma glucose is basically normally done early in the morning after fasting for about 8 to 10 hours. So no food, just water. And the normal levels in a healthy individual is less than 100 milligrams per deciliter. Pre-diabetes will be those individuals who fall between the range of 100 to 125 milligrams per deciliter. And a diabetic patient or a diabetic person will have fasting plasma glucose in the range above 126 milligrams per deciliter or higher. So I believe that here in Canada, we use a different system. It's in millimoles per liter, so the numbers are a bit smaller. So a normal individual will have about 5.6 millimoles per liter or less. And then those that will be classified as pre-diabetic, you'll be between 5.6 to 6.9 millimoles per liter. And a diabetic will have a fasting plasma glucose 7 millimoles per liter or higher. So now some major complications of diabetes. So the complications of diabetes are normally grouped into microvascular and macrovascular complications. So microvascular just means in the small arteries of the body, and macrovascular is the large arteries of the body. So with the small arteries, these are like the arteries that supply the eye, the kidney, and basically the brain. So with the eye, there are three conditions that are normally associated with diabetic patients. We have diabetic retinopathy, which is one of the most common leading causes of new onset blindness in adults. There's also cataracts and glaucoma. And with the kidneys, what diabetes can do is that it can actually lead to high blood pressure. So hypertension is actually a risk factor for diabetes, but at the same time, patients with diabetes who don't have high blood pressure can actually cause high blood pressure as well. So it is both a risk factor and a complication of diabetes. So now we have neuropathy. I misspoke earlier by saying that the small arteries to the brain. The brain is actually supplied by large arteries. When we speak about neuropathy, we're talking about the peripheral nerves. So basically in your hands and in your feet. And something with diabetes that is quite common is the distribution of this neuropathy. It's called a glove and stocking distribution. So basically your hands where you wear your gloves, and then stockings all the way up to your knees. So what happens is that this may result in pain or numbness. And then when we come to the macrovascular complications, we start with the brain. So diabetic patients are at increased risk of stroke and other cerebrovascular diseases, including transient ischemic attacks and cognitive impairment. And then with the heart, like I mentioned before, it can lead to high blood pressure and insulin resistance, which is an effect of diabetes, type 2 diabetes, increases your risk of coronary artery diseases, coronary heart diseases. Okay. And then in the extremities, this is another common complication of diabetes. So with diabetes, because of the excessive amounts of glucose in the blood, glucose sometimes binds to certain proteins in the blood, which then deposit into the arteries. So it stiffens the arteries, it narrows the arteries. So there's less blood flow to the extremities, which leads to ischemia. So there's not enough oxygen being delivered to these tissues. So the slightest injury, like the slightest cut, makes it's very hard for that wound to heal. So this, if not properly managed, can lead to gangrene and other complications, including leg amputations and hand amputations. So now we move on to ways to prevent diabetes. And before I speak on that, let me just say that there is no prevention for type 1 diabetes. So I know some of us, we like to go on TikTok. We like to listen to what people are saying. They might say that do this, do that. It will cure you of your diabetes. There is no cure. As of today, there's no cure for type 1 diabetes. And even with type 2 diabetes, there is no cure. But if effectively managed, you can have normal blood glucose levels only if you effectively manage it. But there is no cure for type 1. There is no cure for type 2 diabetes. Only proper, effective management. So when we speak of the prevention is basically mainly for those in the pre-diabetic range. So ways to prevent your pre-diabetes from progressing to type 2 diabetes. So we start with the most important is lifestyle changes. So with the lifestyle changes, the first thing we'll speak about here is the diet. So this is the ADA, American Diabetes Association. This is their meal plate for diabetics. And this goes for anybody who's trying to plan a healthy meal, basically. So they suggest that half of your meal plate should consist of non-starchy vegetables. I'll give examples of each of these in the following slides. So non-starchy vegetables, 1/4 should be carb foods, and 1/4 should be proteins. And basically drinking water or any 0 or low calorie drink is advised. I would advise that you stick to water and eliminate all juices, soda, pop, and all of that, and stick to just water. So here are some examples. So over here, we have the non-starchy vegetables. So non-starchy just means that it's low in carbohydrates. So broccoli, dark leafy greens, cauliflower, asparagus, cucumbers, you have carrots. So bell peppers, whether red, green, or yellow, are all good. Mushrooms, cabbage, eggplants, and so forth. And then with the carbohydrates we have here, so we have bread, but not just any kind of bread, like whole wheat bread. There's squash, we have fruits, potatoes, sweet potatoes specifically, and then things like beans, peas, and lentils. And then for the proteins, we have fish, so like salmon, tuna, and we have chicken, tofu, eggs and cheese, nuts, and beef, but lean beef. So beef that has low concentrations of fat in it. So here we have like an example of what a healthy plate should look like for a diabetic patient or a pre-diabetic patient. So we have here the broccoli, carrots, cauliflower. So these are the non-starchy vegetables. And then here for the carbohydrates, these are whole wheat. This is whole wheat pasta. And right here we have some chicken breast. And also another thing is portion control. So I think the best advice I can give you is that find like a local dietitian. If I think here in Canada, I think there's easy access because healthcare is free and whatnot. So I would advise if you're here in Canada to find like a local dietitian that can actually help you plan out your meal. So you can actually just, let's say you take a normal week, let's see what you eat in a normal week, write it down, and then go see this dietitian, and then they'll help you like basically rearrange it and make some changes to have a healthier meal plan. So I won't spend too much time here. I just want to introduce you guys to the glycemic index. So the glycemic index is basically as a rating system that they came up with to basically let you know the different kinds of foods and how quickly they raise your blood levels. So if you're a pre-diabetic or a patient who has diabetes, you want to stick closer to the foods that have a low glycemic index. So things like ginger, cucumber, tomatoes, grapefruit, pistachio, and whatnot. And then we have those in the medium glycemic index, which include croissants, kiwi fruit, papaya, and whatnot. And then I would advise you stay away from the foods that have a high glycemic index, because high glycemic index means that they rapidly raise your blood sugar levels, which is not good for patients with type 1 diabetes, type 1, type 2, or pre-diabetic patients. So besides diet, other ways to prevent the progression of pre-diabetes to type 2 diabetes is weight loss. So according to the American Diabetes Association, says losing 5 to 7% of your body weight through diet and exercise is a key strategy for preventing type 2 diabetes in individuals with pre-diabetes. So weight management is also another thing that you can discuss with your doctor and see the best ways, because every patient is different. So everything I'm saying here, you should take with a grain of salt, because each one of you are different. You have different comorbidities that may affect your treatment plan. So everything that any information that you gain here that you feel like you want to implement into your lifestyle, just be sure to consult your family physician about the best way to go about it. And then with activity, so according to the American Health Association, they recommend at least 150 minutes of aerobic exercise per week. So you can divide this into, let's say, 30 minutes of exercise every day during the weekday. So these include brisk walking, so not just casual walking, like just walking with a bit of effort in it to the point where you can actually feel your heart beat and maybe even sweat a bit. If you're somebody who's fit enough to jog or go on runs, I would advise that you do that too. Cycling, going out riding your bicycle is also a good method. Swimming, if you know how to swim, swimming is also a perfect exercise to do it. as a way to reduce your blood glucose levels. So the thing with exercise is that as you're exercising, your body needs energy, and the energy they produce this energy from glucose. So if you have glucose in your bloodstream, what the body does while you're exercising is that it increases the uptake of glucose into the body. Besides weight loss and activity, detection is also very, 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 very important. So, like I mentioned previously, if you know you have certain risk factors that increases your chance of having type 2 diabetes, speaking to your family physician and having regular screening is also very, very important. And also, you don't even actually need to wait to see a doctor. With some of the investigations I mentioned before, there's fasting glucose, your HbA1c level, and also being on top of your blood pressure and your cholesterol levels as well. So now we have avoidance of risk behaviors. So if you're somebody that smokes, smoking is ill advised for any healthy individual, but especially those with prediabetes and diabetes. And I know I wrote here limit alcohol intake, but if you do take, I know we're SD, we don't drink. So, but if we're being real, a lot of people do. But alcohol is bad for diabetics because alcohol is a lot of carbs. So as soon as you take in alcohol, it's broken down into glucose, which raises your blood glucose levels up immediately. And also another thing is to find effective ways to manage stress. I think I'll touch up on that in the later slide. So here we have the 5 M's for diabetes self-management: mood, meals, movement, medicines, and minutes. So I think mood is something that is overlooked a lot. So being able to know how to handle like stress is also very, very, very essential, because when your body is under stress, what it does is it releases stress hormones, and these hormones increase the body's levels of glucose. So if you're always operating under a constant level of stress, maybe you're not getting enough sleep, or maybe you're overworking yourself, or whatever issues you have going on in your personal life or work life, you're letting it get to you. Like all of these things like increase your body's levels of glucose. So just being able to come up with a particular plan to help control your stress is also very important. And one advice I can give is if you're somebody who works a lot, you shouldn't wake up and then be in panic mode that like, oh, all of a sudden I have to get to work. Like getting to work shouldn't be the first thing on your mind when you wake up. So if you know you start work at 7 and you're waking up at 6 and you feel like it's too close to the time, so as soon as you wake up, you brush your teeth, you put together some breakfast, and then boom, you're on your way to work. That alone is operating under a certain level of stress, which increases your what's it called, your glucose levels. So if you're somebody, if you have to wake up a bit earlier, go to bed a bit earlier so you can wake up and have some time for yourself, do your daily devotion, meditate upon how you want your day to go and whatnot. That's ways of effectively managing your stress. So when it comes to the meals, so the meals is what I discussed earlier, the diabetic meal plate, making sure that one half of your plate is full of the non-starchy vegetables, and the other half is divided between your proteins and carbs. And now when we move to the movement is the aerobic exercise. So cycling, swimming, the brisk walking, making sure that in the week you have at least 150 minutes of exercise minimum. So if you're somebody who can do more than this, go ahead and do more than that. But this is the minimum advised requirement. So the medicines. So the medicines mainly, so like I mentioned before, all type 1 diabetics will be on insulin. Not all type 2 diabetic patients. A lot of times just the lifestyle changes, which is the diet and exercise. A lot of patients are able to effectively manage their blood pressure levels with that. But some type 2 diabetic patients are on some medications, which include insulin. So just making sure that you're taking all of these medications appropriately is also very, very, very important to managing your blood glucose levels. And then here we have minutes. So the minutes, basically the timing of everything, like making sure the human body loves routine, right? So putting yourself in a good, healthy routine is very, very important. So what I mean by that is like making sure that you're going to bed at an appropriate time and making sure that that bedtime is stable, making sure that the time you wake up is stable. So you're not maybe going to bed at 8 today, then tomorrow you're going to bed at 9:30, then the next day you're going to bed at 10, and then you're waking up at 4 a.m., 5 a.m. No, just making sure that you have a set time for everything. And obviously, as us adults, make sure you're getting at least 7 to 8 hours of sleep. And then with the minutes also referring to the time in which you eat, making sure that you're eating at appropriate times. So making sure you're not having breakfast at 2 a.m. and then having dinner at, 2 a.m., 2 p.m. and then you're having dinner at like 10 p.m. and then you're going to bed like 30 minutes later. That is not advised. And then the time that your doctor has given you to take certain medications, which includes the insulin, making sure that you stick to that is also very, very, very important to managing your blood glucose levels. So here we have the prognosis. So basically the prognosis refers to the outcome of diabetes. So the outcome of diabetes, if not properly managed, is very, very poor. So we mentioned some of the complications, including increased risk of stroke, heart disease, peripheral neuropathy, poor wound healing. That can even lead to amputations and so forth. But if you do properly manage diabetes with a healthy diet, making sure that you exercise regularly, making sure that you properly control your stress and whatnot, diabetes is, you can live just as long as a patient without diabetes. So, but however, as I mentioned here, without proper control, chronic high blood sugar can lead to severe complications, including heart disease, kidney disease, vision loss, and nerve damage, which can shorten your lifespan. So managing blood sugar through diet, exercise, and medication is crucial for a better long-term outlook. So these are some things that also affect the prognosis. So like I said, glycemic control. Consistently managing your blood glucose levels is the most significant factor in determining prognosis. And then your lifestyle. So regular exercise, a healthy diet, and maintaining a healthy weight are also key to better outcomes. So management of the other risk factors is also very, very important. The two main ones that I would talk about here is your high blood pressure and high cholesterol levels. So being able to effectively manage your blood pressure and cholesterol levels are also key to improving the life expectancy in patients with prediabetes and diabetes. So here I just briefly go over some myths versus facts of those with diabetes. So a myth when it comes to diabetes is that eating too much sugar causes diabetes. So this is both a myth and a fact, but it's a myth because sugar itself does not directly cause diabetes. What sugar does is that excessive intake of sugar can lead to weight gain. So weight gain leading to obesity or you being overweight is a major risk factor for type 2 diabetes. And in fact, those who are overweight or those who are obese or obese, that alone like leads to the insulin resistance. So that means that your body will be producing insulin, but it can't effectively use it. Now we have here, I think I mentioned this before, type 2 diabetes is curable. The key word here is curable with diet and exercise. No, there is no cure for type 2 diabetes, but it can be managed effectively through diet, exercise, and other treatments. Some people may achieve remission and maintain normal blood sugar levels. Now we have the third one. Says people with diabetes cannot eat any sweets or desserts, which is not true. So the key to whether or not you have diabetes or not, even if you're a healthy individual, the key is maintaining a healthy and balanced diet plate. So which includes eating all foods in moderation. So it's about portion control and fitting treats into an overall healthy eating plan. So if you're somebody who eats a healthy amount of vegetables, a healthy amount of proteins, a healthy amount of carbs, indulging in some sweets from time to time, there's nothing wrong with that. So for the last one, it says, I can stop taking diabetes medicines once my blood sugar is under control. So some people with type 2 diabetes are able to control their blood sugar without medicine by losing weight, eating a healthy diet, and getting regular exercise. But diabetes is a progressive disease, and over time, even if you're doing all you can do to stay healthy, you may need medicine to keep your blood sugar within your target range. So the key word there is progressive. So just because you feel like you've been able to maintain your blood sugar levels accordingly doesn't mean that you go off the medications that have been prescribed from you, especially those with type 1 diabetes. They are the ones that you normally hear in the news that a person was in a medical coma, got in an accident and whatnot. Sometimes you might think that because your blood sugar level is under control that you're okay. No, you have to keep on it as a lifetime thing. So thank you for listening, and that's the end of my presentation on diabetes.
Amen and amen. Mam Difi.
Adofo no yɛbɛda Awurade ase Ebenezer de ɔde abɛduro ɛyɛ adom yɛn nyinaa yɛnim saa yadeɛ wɔ edi a ɛdi yɛn nya yɛde Awurade ase papaapa sɛ ɔnam doctor so ama yɛhu nea ɛwɔ sɛ ɔyɛ a ɛbɛboa yɛn mpɔmudene Nyame ade hyɛ yɛgyae line no mu ɛde ɛma yɛn ho ɛyɛ asɛmbisa ne ɛmmoa nti anidie mu wobɔ wo din a na waka baabi a wokasa afiri nti megyae line no mu ɛde ma Nyame ma meda mo ase.
Hello?
Ipacha wɔ so.
Ano do fie. Mepacho, me question yi de, me say doctor, say esi pae kakra, so obetumi aboa me a. Me ho go bi wo me ncha ha say na. Say de o kyerɛkyerɛ enuane na ankɔyɛ aduro na enuane. Wo se me opa me kyɛ o me misa mo say ono ne problem na nyɛ diabetes na o anemia. Na wo mpɛ sɛ obɛfa aduro bebree wo sha. Nti nka doctor betumi aboa na nka o kyerɛ na aduro bi a enuane nnuro bi a ɛbɛboa na ma ne mogya ne timi aristo ama no. Nka ne ni bɛgye ho. Me nim sɛ obetumi aboa me saa kwan no so de a.
Yeah, I can answer that.
Okay. Thank you.
So the thing with the anemia is I can't really give too much advice on that because I don't actually know what your blood levels are and what exactly is causing the anemia. So my advice I'd give to you is that you do have to see your doctor, and whatever your doctor is advising you to eat or to take in terms of medication is best for you. So I mean, there's a lot of foods that are rich in iron and so forth, but depending on what your cause of the anemia might be, you might have to be on medication. So I can't tell you to not take any medication and then stick to foods rich in iron and so forth. So my best advice would be to speak to your doctor, and whether in combination with the medication and the foods rich in iron, then you do both. But I can't tell you not to take the medication because I don't know what is causing your anemia.
Okay. Okay, thank you. O TNT medase.
Yo.
I'm sure.
Mpacho, me want some bisa kakra.
Mepacha bebree ahobrɛaseɛ mu mesrɛ wɔ ani deɛ bɔ wo din na ka baabi a wokasa firi meda ase.
Yo, Mr. Yefemi Jane, make us free Georgia. Now, my sim bisa ne say, pre-diabetic and type 1 diabetic, are they the same?
Okay. So no. pre-diabetic and type 1 diabetic is not the same. So with type 1 diabetic, type 1 is an autoimmune condition. So what that means is that normally your body recognizes the cells that are in the body, and it doesn't attack those cells. What it does is, if you get an infection, your body recognizes the substances coming into the body as foreign, so it attacks those. But the problem with type 1 diabetes is that your body mistakenly identifies some cells of the pancreas as foreign. So it attacks the pancreas, and then the pancreas can't produce insulin at all. So that's what leads to the high levels of blood glucose in the blood. So type 1 is an autoimmune condition. But with pre-diabetes comes from lifestyle choices, basically. So it can be poor eating, lack of physical activity, lack of stress control, and so forth. So pre-diabetes is what progresses to type 2 diabetes. I don't know if there's clarification in that, or if you want me to further explain.
So can we reverse it even if you start, and does age also contributed to it too?
So age contributes to both. With type 1 diabetes, it's mainly found in adolescents. So basically, as I mentioned, there's two particular common age groups with type 1 diabetes: 4 to 7 and 10 to 14. 10 to 14 is the most common age group to be diagnosed with type 1 diabetes. And with type 2 diabetes, age is a risk factor. So those above 45. So like the older you get, basically, the older you get, the body itself kind of starts producing less and less insulin. So like your body isn't as able to bring in glucose as it once was before. And pre-diabetes is what can be reversed. So you can, but type 2 diabetes, it can only be managed. So you can manage your blood glucose levels to the point where like your blood glucose levels are normal. But like there is no permanent regression of type 2 diabetes.
Okay, the question is, for the last 12 years, my mom has been taking pre-diabetic medications, and she exercises, she eats, although, African woman, she will eat her carbohydrate, but still she watch a little bit, but it never come down. So I can say that she eat a little bit well. That's why I wanted to know if it can reverse if she is pre-diabetic.
You said she's on, do you know the particular medication?
Yeah, she's been taking metformin.
Yeah, so metformin isn't for pre-diabetics. That means she's been diagnosed with type 2 diabetes, or?
Oh, really?
Yeah, metformin is given to type 2 diabetic patients. So once you're on the medication metformin, that means you have type 2 diabetes.
And type 1 and type 2, which one is serious?
They're both serious. But the thing is just how they present. So the complications of type 1 diabetes is a bit more acute. So they present more suddenly compared to type 2 diabetes, but they're both just as serious.
Okay. All right. Oh, I didn't know when you take metformin, that means you are.
Yeah, metformin, normally that's what, because if you're just pre-diabetic, the best thing for you is making sure that you have a healthy diet, and then you do the exercising. So diet and exercise.
So why you don't take any medication?
Or
if you are not, like, if you are pre-diabetic, that means you don't take any medication. You just watching your diet.
Yeah, normally pre-diabetics are not on diabetes medications.
All right. Thank you for clarification.
You're welcome.
Mami mpacho no obi apagya ne nsa. Mami Jo.
Hi, Josephine from Toronto. Thank you, doctor, for your program. I just have a question. So, a lot of our parents, once they are diagnosed with diabetes for a while, I noticed that they become relaxed. And I'm really happy you talked about staying on medication. But sometimes when they go to Ghana, they start taking what they call Bibidro, and they feel like the Bibidro, they can mix the herbal medicine with their prescribed medicine. So can you just say a comment on that? Like, is that safe? Is that something that's advisable? Because I feel like it's a really big problem.
Yeah, what I could say about that is, so not all herbal medication is bad, first of all. So there might be some herbal medications that's actually good at reducing blood sugar levels. But the thing is, like, you have to like consult with your doctor, because there are some medications that they affect the absorption of the medication that you might be on. So because of what herbal medication you might be adding to the prescribed drug, it may render the actual prescription like ineffective. So whatever, even if you go to Ghana, whatever herbal medication that you might come across of, or whatever natural remedy that you might see online that you want to try, just make sure that you consult your doctor first, because some substances do affect the absorption of the medications that you are on.
Okay, thank you so much.
Achọọsọ.
Okay. Nana Joa, I'm from Virginia, but I knew that they said cinnamon also help with diabetes.
All
Cinnamon,
right, I can't.
is it true or not?
Can you repeat your question, please?
Cinnamon also help with diabetes.
Like treatment?
Cinnamon.
Oh, cinnamon.
Yeah.
It can help because cinnamon is actually good reducing insulin or improving insulin sensitivity, actually. So with type 2 diabetes, like I mentioned, like insulin, it becomes resistant, so it's not able to properly work. But cinnamon, does help improve insulin sensitivity. But like all at the same time, like with all of these things that you might see online, my advice to you is that speak to your family physician about it, because like I said, every patient is different depending on what risk factors or what other comorbidities that you may have. Just whatever you may come across online, speak to your family physician, because he can actually give you the best advice, which is tailored specifically to you the individual.
Thank you.
Me pacho with your point the microphone be saying maybe some questions here. Previous years, about 2 years before, me checking my coffee, my cholesterol was like 206 or something. And the following 6 months, me call another blood work. Now the cholesterol shooting from 2 something to 400. So now even the doctor was doubting. So around 3 weeks time, no, then he asked me to come and redraw again and let's see. And it was the same. So, and he started putting me on a cholesterol med. But the question is, Miobia, I'm very careful about what I eat. I don't eat late and all that. And I can see that what I snack most like nuts. I really love nuts. I'm not contributed to that too, because I thought not give a good cholesterol, not, So
Yeah, nuts would not.
that?
What kind of nuts are we? Can you be more specific?
Like
what kind of nuts
mixed nuts,
usually?
like almond. I can like make it myself, almond, peanuts, and all the nuts, and I mix it with dry berries and all that, and mix them and make it myself. Sometimes I'll eat it with yogurt and those things, So I was
Yeah.
snacking on those things.
Yeah, nuts will not cause your cholesterol levels to be that high. I mean, there's sometimes it could be familial, so it could be something that runs in the family. Sometimes it could be a genetic cause. So your doctor should probably check for those. But nuts in general, no, nuts will not cause your cholesterol levels to rise that high.
So
Nuts
I've been
actually will lower.
exercising. Okay, go ahead, sir.
But I'm just saying what you were saying. Like generally, nuts do like decrease cholesterol levels. They will not raise your cholesterol levels that high.
So
So like things like almonds, walnuts, and so.
I'm in my middle age, and it could be that too, because I've been like made trials and me figure out what did I do wrong that it causes bad. So it could be like generic, right?
Yeah. So when the doctor saw it was that high, he just put you on medication?
Yes. So since then I've been taking medication, though he started me with the lower dose though.
Mm-hmm.
And I'm getting the side effect from the medication or the palpitation and those stuff. So, but I still taking them. I don't want to stop taking them.
Yeah, with your cholesterol levels being that high while you're still on the anti-cholesterol medications, I think it could be familial. So that one is genetic testing that they do to confirm.
Oh, there is a test for that they can do to confirm that, right?
Yeah.
Oh, okay. All right. Thank you. Then I'll find out.
Thank you. No problem.
Hello. Anadjo again. I'm from Virginia. Vitamino also help with diabetes. Vitamino also helped me. I was diagnosed with diabetes, and my blood sugar went up to 12.5, and I was taking Vitamilo, and it came down, and I walk every day, 40 minutes for 4 days. When I went back to check my sugar, it came to 5.8. So also help, and walking is good. It's called Vitamilo. It's India hen.
Oh, okay. I mean, to be honest, I'm not familiar with that particular medication.
Okay.
Is it a fruit?
Yeah, it's like fruit. It's very
It's
good.
like watermelon.
Yeah. It's not
But that one called beta melon.
It's not. It's Vitamilo. It's not.
Oh,
Yeah, Vitamilo. It's very good.
like bitter melons?
It's like a kind of fruit. When you go to Indian store, just check it. It's very, very
Okay.
good. When you drink and you walk 4 days a week, everything goes down for you. Thank you.
Thank you for that.
Hello. It's almost like cucumber.
Oh, sorry. Because I'm to be Casa. If I'm Yamoba, because I feel Pittsburgh, Pennsylvania. Dr. Eda was say. If I told me aunt, what is 75 or type 2 diabetes. Now, ni A1C. Last but one or check here, na 6.8. Now, say or check here, na 7. Now, more can say. Ni age ni the enka normal. And now, things or no metformin. 2 in the morning, 1 at night. At times, or checking an opebia and blood sugar and opa, ebi obenya 99, ebi obenya 106, ebi obenya 101. But time bia obekwa checking the A1C bia no or 7. But daily ones so no dey low. Nti say no. Osimi mi sama say then necessary. Okohu ni doctor or the ne record ni nyina akọchire no, but oso nguso anum 2 in the morning, 1 at night. No. Sometimes onum 2 no a enu awi ano na it say
ni sugar no kɔ fam this ɔkɔnom biribi ansa na aba soro kakra mpakyɛ wobɛtumi ama na advice kakra ma ndase.
Yeah. Well, from the Waka Germany, it sounds like everything is fine. There's no issue at his age with the 7%, and then the normal blood glucose levels, like he said, under 100. He's fine. There's nothing else that needs to be done with him.
Oh, okay.
Yeah, okay.
Oh, okay. That's.
Yeah.
But we patrol, Osi say Mr. Otimenche na Minister Ban. Say Osi say bi o ha die be back to say 104 no. Otiminum 2 no in the morning. And I said there be 90 no one. And I uncle sunu 2 no in the morning and 1 in the night. Not for me no na asem na nka.
Yeah, what is his normal prescription?
Normal prescription here 2 in the 3 a day, 2 in the morning, 1 at night.
Yeah, then he should stick to that. No changes need to be made.
Oh, okay.
Yeah.
Yo, that's.
Ipamacho, yeah, the brain area Juma 80 Obi was Simbis. Okay.
I'm free Philadelphia. Yeah, me one question. Na doctor I can say pray Obi pray.
Ohiman Pacho, Yanti won't can you any demo.
Okay, they said they are what?
Me Pacho Fede Yeti, me that's it.
Okay, yes. Okay, near me started. Me say said the doctor can you know. So opinion na say or more that those say or yeah. Akola no to me enya bi. But minimum kola ni bi o mi school a omo say 7 years, 8 years. Omo parents ni bi. Nso nkola no ewo bi a if you omo monitor bi no kra wo insulin nti sa no dey na happen mani basa epese me. If I tell doctor what did they make an say?
Yeah, I think the material.
Okay.
So from what you're saying is that in Kolani Biwaha, like their mothers had or their mothers didn't have any diabetes, but they have it?
Yes.
Okay, so that would mean most likely those kids have type 1 diabetes. Yeah, so with the diabetes in pregnancy, which is gestational diabetes, that one has nothing to do with type 1. That one increases your chances of having type 2 diabetes.
Okay.
Yeah. So it's a different type of diabetes that those children have.
Okay. Okay, me that's it.
You know.
Yo, mame, Derek Nekasa free New York, me basulate into me nim say be another doc. I can't read there. Doc say apart from say the doctor na a bit to me actually say we are diabetic. So say to me unya doctor man no check bisa. What symptoms ben ye bit to me who say a dead dear naturally say bia we are diabetic.
Okay. So with diabetes, there's 3 classic symptoms. They call it the 3 Ps, right? Polyuria, which means excessive urination, or breathe. Polydipsia, excessive thirst, drinking a lot of water. And then polyphagia, which is excessive hunger, always having a constant state of feeling hungry. So those 3 symptoms are the most common, but other symptoms can be like blurry vision, poor wound healing, cognitive impairment, and all of those. But the three main or the three classic symptoms would be the excessive urination, excessive thirst, and excessive hunger.
Thank you.
Pacho, chimbisa question kakra. Michael, kase free Cincinnati.
Epacho kasa.
Yeah. Oh, Pacho, HSA, sa yari we no, and go to a drew swa. That means, for the rest of your life, no, a drew won't mean free swana.
It depends whether or not you're on type 1 or whether or not you have type 1 or type 2 diabetes. So with type 1 diabetes, you will always be on insulin because with type 1 diabetes, your body isn't producing enough insulin or it's not producing insulin at all. So that means that your body really has no way of utilizing the glucose in the bloodstream. So with type 1 diabetics, it's a lifelong thing. With type 2 diabetic patients, sometimes a lot of type 2 diabetic patients don't even need to be put on medication. But like if lifestyle choices or lifestyle changes such as proper diet and then exercise is not able to effectively reduce your blood glucose levels, then you can be put on medication. And sometimes with the combination of the lifestyle choices, the lifestyle changes, and the medication, your blood glucose levels can become normal. So your doctor might be able to take you off the medication so long as you maintain the healthy dieting and the proper exercising. So it depends. With type 2 diabetic patients, it might not be a lifelong thing, but with type 1 diabetic patients, it is a lifelong thing.
Thank you.
Adɔfo no yɛbrɛ ne nti no sɛ obiara nni asɛmbisa a mɛsrɛ sɛ nso obi wɔ asɛmbisa a obɛtumi de aba na dɔkta abɔ adesua no nyinaa atɔ fa de ama yɛn. Sɛ ebi nso nni hɔ deɛ a ɛneɛ na dɔkta bɛbɔ adesua no nyinaa atɔ fa de ama yɛn. Meda mo ase.
Maame Dufie.
Mame.
Sorry, I do want to say one quick thing. I think there was a lady who said her mother or
Dr.
something had. Oh, okay.
Mame Pacho Kasa.
Basmati rice, for diabetic or
Pacho Mentio.
Basmati rice, say diabetic in obedi. Basmati rice, no.
Say that again?
Basmati rice.
It's a variety, a different, like, we have Uncle Ben's rice and different types of rice. So
basmati. Okay.
Yeah. Mm-hmm.
I think it depends on the portion. So like I was saying, it might not be the best if you have diabetes, but basmati rice is generally better than just plain white rice. But it's all about the portion, like the portion you're taking per meal.
Mm-hmm. Thank you.
Dr. Pacho, yɛbɛsrɛ wɔ ne deɛ mu na wabɔ adesua ne to fa de ama yɛn. Meda ase.
Okay. So basically, in summary, I think what I want to leave with you guys is that diabetes is actually a very, very serious medical condition. It's not something that you should take lightly at all. Even if you are pre-diabetic as well, don't say or don't think, oh, I don't have type 2 diabetes, so I'm okay. No. Make sure that the most important thing is I like to phrase it as an acronym, DWADA. So D for the diet. Make sure that you're eating a healthy, consistent diet. The best thing to do is like plan out your meals for the week so that you know where your carbohydrates are coming from, where your proteins are coming from, and then where your like vegetables are coming from. And the portion control, don't overindulge. And 2, the weight loss. If you know that you're somebody who's obese or overweight, try your best to implement like daily exercises, like the walking, whether you can swim, cycling, whatever you like to do as exercise. Make sure you implement that to try and lose the weight, especially those of us or who have the more weight you have above your waist, that's the worse it is, especially for those pre-diabetics and type 2 diabetics. And like I was saying, like avoidance of certain risk behaviors, smoking, alcohol, all of those things need to be completely cut out. And then last but not least, the detection. So doing it both at home and then making sure that you're going in for whether it's your yearly for pre-diabetics and every 3 years for those who have diabetes is also very, very, very important. And I think that's pretty much like the most important points that I want to leave with you guys today.
Eda, otin mpacho. Line so.
Yes, please.
Oh, bibia ubeka ede ama doctor na mijebo de mao. Medase.
Yo, adofonom, emianom ni adofonom ye dewurade ase paa wo.
Amen.
Kwaya ofa na kwa so akyerɛkyerɛ yɛn sɛdeɛ yadeɛ ne si tie kwaya bitumi afa so manage na ya prevent na afei nso yɛnya afiri yɛ so koraa sɛ if I can look at the statistics now or Canada ni US no every 3 minutes bia obinya bi and a quantity of nipa ɛso yɛn anaasɛ ɛda yɛ so srɛ Awurade mmɔborɔhumfoɔ sɛ ɔhu yɛn mmɔbɔ na bra yɛsua nneɛma a ɛte sei no ɛnwodwo ano na mmra ɛmmoa yɛn ɛyɛ nyame pa a ɔde yɛn nkwa fam yɛra next week mesrɛ wo a sɛ to nsa frɛ wɔ bi ɛfiri sɛ program ɛnam kwan mu no ɛyɛ extraordinary nka ne saa extraordinary especially yɛbɛka wei sei no ho deɛ no but yɛbɛka no with the angle sɛ ma waduane a wodie no ɛnyɛ waduro na ɛnsa wo yadeɛ waduane a wodie no the type of selection a woyɛ no ɛbɛko yɛ yadeɛ wɔ mu nyinaa sɛdeɛ nyame de ma yɛ no nti nnuano mesrɛ mo mommyɛmmɔ ho dawuro na yɛmmra na yɛmɛti na menim sɛ nyame ɔbɛgye yɛn menim sɛ Brother Derek wɔ so a announcement bi wɔ akyirɛ a mɛyɛ kom na nyɛ saa deɛ a mɛma mame wama deɛ ɔbɛbɔ mpaeɛ ama yɛde ahyira so no na afei yɛma me Rosina nso abɛpɔn sɛ nso Pastor Bexon wɔ so a mesrɛ sɛ obɛtumi akasa. Alright. Ɔmo biara ni so a nyame yɛ adom a ɔkyena onyame de yɛnkwa fam yi a yɛbɛyɛ anɔpa sɔre anɔpa no.
Ɛda mpakyɛw yɛ ananka yɛnkɔdɔ ayi ne nti no mu wie na mu hyira so ansa na nka announcement no ne wei sei no.
Alright.
Bɛkata na yi.
Mɔma yɛ mɔ mpae.
Amen.
Na ne nyame mmɔborɔhufoɔ anwummere yi yɛda wase. Eyi wɔ yɛ kamfo din wɔ kwan nwanwaso a wobɔɔ yɛn na afei bɔne nti yadeɛ korankora ti sɛ yɛabɛtena yɛ so ɛne yɛ adɔfo nom. Anwummere yɛda wakoa no wofa no mu kasa kyerɛ yɛhyɛ wo nsa yɛserɛ wo ma no nimdeɛ akɛse a wobɛtumi de ayɛ wei no bebree aboa yɛn mu bi ɛwɔ saa nneɛma a yɛtie yɛde kyerɛkyerɛ na ɛbɛboa yɛn. Woyɛ ne saa ma yɛn a soronko kwan so yɛwɔ yɛn mmɔfra yɛwɔ yɛn mmɔbunu yɛn mpanyimfoɔ a yareɛ bi wɔ wɔn so a ɛno nso ayɛ haw ne amanneɛ. Woyɛ nyame a woyɛ yaresafoɔ tian this week deɛ woka ne sɛ wobɛko yɛ ko ama yɛn saa gyidie yi nti yɛde saa yarefoɔ a wɔyɛ mu nyinaa yɛhyɛ wo nsa. Anwummere yi nea yɛsrɛ ne sɛ berɛ a ɛnkyɛ ne yɛbɛdi ne ntitimu akɔ yi Awurade boa yɛn na yɛaduane a yɛdie yɛnsuo ɛnyɛ yɛduro na ɛnsa yadeɛ ma yɛn napa na fa homeda nhyira nso dom yɛn wɔ Yesu din mu. Amen.
Pray anytime. Pray when you're sad. Pray when you're glad. Pray when you're weak. Pray when you're strong. Just pray and pray, 'cause anytime is prayer time. Pray, pray, pray anytime. Pray when you're sad. Pray when you're glad. Pray when you're weak. Pray when you're strong. Just pray and pray, 'cause anytime is prayer time. Ooh. The offices in heaven, they're opened up for you every second.